Hello doctors, welcome back to our NEET MDS 2021 recall series. In this video, we are going to see about an important condition, that is cherubism. So what is cherubism? So here you can see the picture, and in this picture the boy is exhibiting an abnormality in his cheeks. So a cherubism is associated mostly with cheeks. So it is a rare genetic disorder which causes prominence in the lower portion of the face. So what are the signs and symptoms? So as you can see in the image, the skull here is showing a lot of growth in the lower portion of the face. So what is the signs? So the condition usually becomes evident around 2 to 5 years of age. Okay, so although in mild cases the diagnosis may not be made up to 10 to 12 years. So the appearance of people with the disorder is caused by a loss of bone in the mandible, which the body replaces with excessive amounts of fibrous tissue. So actually this is not bone. Okay, this is not bone. There is actually a loss of bone in the mandible, and that is replaced with fibrous tissue. Okay, so it also causes a premature loss of primary teeth and lack of eruption of the permanent teeth. So the patient looks like plump, cherub-like cheeks, so as you can see, and which results from painless bilaterally symmetric expansion of posterior mandible. So as you can see in the skull here, the anterior mandible is okay, but the posterior mandible is showing a greater expansion. So in early disease, they can also be presented with cervical lymphadenopathy, which can also contribute to the apparent fullness. And in severe cases, there is involvement of inferior or lateral orbital walls, which may tilt eyeballs upward or retract the lower eyelid. Okay, so thereby exposing sclera below iris to produce an eyes upturned to heaven. So in mandible, lesions frequently develop in angles, that is angle of mandible, ascending rami, and coronoid process. Okay, so but the condyles are spared. Okay, angle of the mandible. So in the mandible, angle of the mandible is involved, ascending rami is involved, and coronoid process is involved, sparing the condyle. Okay, in severe cases, most of the mandible is affected. Involvement of maxillary tuberosities or entire maxilla is also possible, and there may be a V-shaped palatal arch. V-shaped palatal arch may also be seen. Okay, then coming to the radiographs. So here you can appreciate the OPG here. So these are the lesions here, right? So these are the lesions we can see, right? So it is appearing as a soap bubble. Okay, so the cherubism exhibits an OPG with soap bubble appearance. This image is given just to help you to remember what is the OPG look like. So there is bilateral multilocular expansile radiolucences. As the lesion ages, it often becomes sclerotic and may reduce in size. Okay, so the question they have asked in NEET MDS 2021 was, again a clinical question. A 10-year-old patient comes to the clinic with bilateral expansion of mandible. Lesion started at the age of 4 and has progressed till now. Identify the condition. Okay, bilateral expansion, fibrous dysplasia, unilateral expansion. This is central giant cell granuloma. It is seen mostly in the center part of the mandible, and Ewing sarcoma is not associated. So the answer for this will be cherubism. Okay, like our video, do subscribe to our YouTube channel. You can also follow us on Instagram at DOCSHAALA for dental content and at DOCSHAALA medical for medical content. You can also find us on Telegram. Thank you.